Hello, everybody, and welcome back to this training. I'm Dr. Tabor Smith, and today we're going to be talking about why patients quit care and how you can prevent it. Look, patients don't quit because chiropractic doesn't work. They quit because they don't understand why they should stay in your office. They don't see the big picture. Maybe they're just after pain relief, or a lot of different things can happen, but they just don't understand why they should stay. They don't understand the bigger purpose and the clearer long-term purpose of why they're in your office. Our job is to continually remind them and reinforce the why, that we're here to re-establish spinal health, structure, function, alignment, mobility, strength. These are things that can be measured, that are getting to the root cause of their problem instead of just masking their issues by covering up the pain like medicine does for the most part. There are really only three reasons why patients quit before they complete a care plan in your office, and every one of them is an education problem. They either, number one, feel better, so they quit. Number two, they don't feel better yet, so they quit. Or number three, life just gets busy and they have to quit, right? When they feel better, what they're tracking, their number one outcome measure is pain. If they quit because they feel better, we need to educate that the number one outcome measure is not pain. Yes, we can track pain. We have pain scales throughout their care plan, but the outcome measures that we want to track because we want to address the cause and we want to explain to them how important it is to address the cause are going to be things like spinal alignment. And we can measure those things through posture evaluations or x-rays. Range of motion, again, we can measure those things. If we're improving mobility, strength, if they're doing exercises for their spine, then over time their spine will continue to get stronger and stronger. Those are the outcome measures that will keep somebody there understanding why they're in your office, why they're continuing with care even after they get out of pain. So we have to continually reinforce the why. Every visit should answer, why should I stay under your care? Every workshop that you do, every email that you send out, every conversation that you have with patients reinforces the reasons and the value for care in your office. Look, there was a study that was done on compliance to home recommendations, and they took two groups of people. One group, they gave all of their home care exercises and the instructions on how to do the exercises. The other group, they gave the exact same home care exercises and instructions, but they showed them the benefits of each one of the exercises, the reason why they should be doing those exercises. The group that was told the benefits and the reasons why they should do the exercises had a 60% higher compliance rate than the group that was just given exercises and the instructions. People need to know why that they're doing something, and this will anchor them to your office. Look, education prevents drop off and drop out early. Education creates commitment. And we need to be sharing and telling them the truth that healing takes time. We live in a fast food society or culture, and everybody wants that quick fix, that pill, that shot, that surgery. But you know what? There are a lot of people that get tired of that because they realize that's not a real answer, and they're miserable because they're having to go back over and over and over and take all of those medications. You see them all the time when they come into your office, and they want to hear from you the truth. Like, healing takes time, and they want to see a plan. Here's the plan to get you where you want to go, and it's going to take time. And we have to be able to share that structure equals function. So we're improving structure here. And when structure improves and function improves, pain improves as well and goes away and stays away because we're actually addressing a deeper cause of your problem. This is why we need to also educate that home care matters. Look, if your teeth are important enough to do something every day from home, then your spine is even more important than that. It's absolutely important enough for them to do something every day at home. Their home care matters. And ultimately, overall, consistency matters more than anything. What if you just brushed your teeth for one day of your life? Would it make a difference? No. What if you brush your teeth for 1 month of your life or 1 year of your entire life? It's not going to make that big of a difference unless you're consistent with it. It's the same thing with taking care of the spine and nervous system. The more consistent we are with that, the bigger the impact. If I brush my teeth for a year of my life, not that big of a deal. But if I brush my teeth for decades, now I've been brushing my teeth for 40 years, I guarantee you I have less tooth decay today than I would have if I had not brushed my teeth for all those years. And it's the same concept and the same truths when it comes to taking care of their spine and nervous system. We got to teach them that consistency matters. And the longer you take care of the spine, the bigger the impact that it's going to make to your overall health. We also need to teach this before they start doubting, right? Don't wait until they're leaving your office to start throwing all this information at them. We need to set expectations on their day one. The first day they're in your office, we're teaching, we're sharing, they're starting to build an understanding, and then we reinforce that every visit. Because missed visits aren't often the cause of the problem. Them missing visits is a symptom of us not educating them. Yes, every once in a while there's going to be a person that just doesn't care. That person is not your ideal patient, right? It's the person that when you educate them, light bulbs go off, understanding starts to happen, and they truly value the health of their spine and nervous system because you've explained why it's important. And now that person is going to be your lifetimer. It's like in dentistry, why does a dentist waste their time teaching you how to floss, giving you a toothbrush and telling you to take care of your teeth at home? They don't make money off that, but they do because that person who actually values the health of their teeth enough to take care of them on a regular, consistent basis, that's the dentist's lifetime patient. That's why dentistry has the biggest retention of any other profession because they teach and educate why it's important to take care of your teeth for a lifetime. And we can create that in our offices as well. We want to build and create long-term thinkers. So we want to change the questions that we ask from short-term to long-term. So not just, hey, how you feeling today? Or how's the pain today? Even though we can track pain scales, I have nothing against that. But that's a short-term answer or a short-term thinker. If we're asking them, hey, how are you functioning today? How are you moving? What have you been doing? What activities have you been doing? How did it feel to do those activities? What do you feel like the progress you've made so far is in our office, right? Those are better questions because now they're thinking longer term and deeper in the correction and functional areas. We want to help them to celebrate healthier habits. Have you been doing your spinal hygiene exercises? Yeah, doc, I've been doing them for about 3 weeks now. Awesome, great job. We're celebrating a healthy habit. They're building spinal hygiene into their daily habits. And then we want to reinforce that vision consistently because patients need reminders. So every time when they come in, we're checking in with them on Table Talk. We've got goals set for them that we can see when we pull up their file. We're doing progress exams regularly. In our office, we do every 12 visits. We do posture evaluations, range of motion tests. We do questionnaires, and then also re-x-rays. That's a great one too. We do re-x-rays at 28 visits in our office, but we're building this vision of future health. And when a patient can see that they are getting better and they can build a vision for them, a better version of them in the future, that's what helps keep patients committed when the pain goes away, right? This is what builds retention in your office. It makes not only better patients for you, it actually gets them better results because when they're compliant and they actually finish a care plan, they're going to get a lot better results than someone who drops out of care. Look, people stay in your office when they understand why they're there. The real bigger, deeper reasons. We always say that a person that comes into your office and they start care, let's say they go through their exam, you present the report of findings, and they say yes to care, those people are believers. You've showed them that you can help them, and they believe you, and they believe you can help them, so they're believers. Now we got to take them and educate them and turn them into really understanders, because an understander is the lifetime patient. Education improves compliance in your office, and compliance raises all ships. It improves the results, it improves retention. Retention grows your practice, and bottom line, ultimately, retention changes lives. So, thank you for being on this training. Keep changing lives, keep implementing spinal hygiene, keep sharing with your patients the importance of taking care of that spine and nervous system. If you need anything, don't hesitate to reach out, and I'll see you on the next one. Thanks.